Well, welcome everybody to ICMDA webinars. I'm Dr. Peter Saunders, the CEO of the International Christian Medical and Dental Association, ICMDA, and this is the 19th in a series of webinars on COVID from medical experts around the world. Today's webinar is on the longer term impacts on global health of COVID, and we're privileged to have with us as speaker today, Dr. Ted Lankester, who I will introduce very shortly. Just a few words about ICMDA. We bring together over 80 national groups of Christian doctors and dentists throughout the world. And the way it works today is that Ted will speak for about half an hour or so, and then we'll have a Q&A after that where you can put any questions to him. You do that by typing them into the Q&A box at the bottom of your screen. No, not the chat box, that's for you to talk to each other, but the Q&A box at the bottom of the screen. And you can upvote other people's questions if you'd like them to be asked, and they're more likely to be in that period of Q&A after Ted's talk. We have translation today available simultaneously into 4 different languages. So today we've got French, Spanish, Arabic, and Mandarin Chinese. That's French, Spanish, Arabic, and Mandarin Chinese. If you'd like to hear any of those translations as we go, then you click the interpretation globe on the bottom bar of your screen, and then you simply choose your language. The only trick is that there's no Arabic tab. So if you want to hear Arabic, then you click the German tab, and that's where the Arabic will be. But French, Spanish, and Chinese are as listed. Zoom is still catching up with ICMDA and its multilingual seminars. So today you'll be watching either on Zoom, and we also broadcast live on Facebook, and the talk will be recorded and available on our YouTube channel afterwards. So it remains to me now to introduce Dr. Ted Lankester, which is a great pleasure to me, having known Ted for many years. Ted's 2 medical passions are global health and travel medicine, and he co-founded InterHealth Worldwide and is now president and senior clinician in Thrive Worldwide, which specializes in the care of mission partners and aid workers. He's co-founder, director of the Aruka Network for Global Community Health as well. Ted travels and lectures widely. He's been on expeditions and driven overland across Asia 3 times. He lived for 8 years in the Himalayas, working in remote mountain communities, helping to pioneer new models of community-based healthcare. He's written books and chapters on travel medicine, and he's the lead author of a textbook on community health published by the Oxford University Press in 2019. He's been on the Leadership Council of the International Society of Travel Medicine, a trustee of Tear Fund, a founding fellow of the UK Faculty of Travel Medicine, and involved also with Christian Medical Fellowship for many years. His wife and best friend Joy died in 2019. Ted's outside interests are travel, trail running, biodiversity, ornithology, working with his local church, and the role of faith in healthcare, and enjoying his extended family. So Ted, we're really grateful to have you here today. Very welcome on ICMDA webinars. Over to you to tell us about the longer term impacts of COVID on global health. Thank you.
Thank you very much. Delighted to talk to all of you and say good morning and good afternoon and good evening or even good night to some of you. I will speak as slowly as I can, and I do apologize if I start to cough or splutter. I have got some adorable grandchildren who give me a lot of love, and they give me a lot of germs, which they did a week and a half ago. So please excuse me if I cough and splutter. The good news is, of course, that you will not catch it. So God bless you all, and I'll now just share my screen, which will hopefully not take long at all. And I hope you can all see that okay. This is a very big topic, and most of us, I think I could say, are guesstimating In fact, it reminds me a little bit of a whole lot of us on a train, stuck in a siding somewhere, on the roof and on the side, wondering where we're going and how we're going to get to our destination. But by the grace of God and by the fact that our Lord loves his world, I do really believe we are going to get to a God-given destination, and some of the gloomiest predictions may not be right. Of course, we all know about COVID, how it all started in one area, now it's zooming all over the planet. We don't need to talk more about that, I guess. Some people like to know what we're going to be talking about, and some like people just to sort of say, well, let's see what happens and I'll be up with anything. But what we are hoping to look at is, in particular, the longer term impact and global health challenges resulting from COVID, and some solutions. And above all, I really hope we'll have time for the added value of the faith-based approaches, including the role of the church. So important, and actually such an exciting opportunity for all of us. So let's just look briefly at some of the sort of current challenges. This is only just for 2 or 3 minutes. I put this slide up because, you know, there are various different directions we can go, right or the left. We're not quite sure which way to go at the moment. So I'm again wanting to emphasize the fact that even the mathematical modelers are not necessarily getting things right for us. Just want to talk very briefly about, if you get COVID, there are some problems following it. This is just a very brief thing. And many of you, of course, working in different parts of the world with different experiences, will know about these things. So it's just really to flag that up. The one that I'm particularly focusing on is brain fog. People that I talk to seem to be suffering from that almost more than anything else. But the interesting thing is that there is a major study being carried out at the moment into the long-term effects. So just look at that website at the end, and this will give you more detailed information in the days ahead. This is a comment from Richard Horton, editor of The Lancet, which is a scary but probably true statement. This pandemic is dismantling the foundations for protecting and advancing health. Global health has entered a period of rapid reversal. De-development is the new norm. Guys, I don't think we're meant to be discouraged by that, but challenged by it. Some current impacts which we're very aware of, and I'm not going to run through all the points that I've written down here, but just perhaps that second one, the huge number of people who are currently being pushed into extreme poverty because of lockdown, being unable to work, being unable to get out and get food for themselves and so forth and so on. So that's a scary comment from the World Bank just 1 month, exactly 1 month ago. Let's just move on to this other current thing before we go on to the longer term impact. I think this slide almost upset me more than any of the others, actually. This terrifying number of cases of gender-based violence, which are happening and have been predicted just 2 weeks ago in The Lancet. And the impact that this is having on families and communities and individuals, and the slight worry about the increase in radicalization, which is also being reported from the UK. Just to say, let's all remember and pray for dear Lebanon at the moment with all of its problems, including COVID and of course the recent disastrous explosion. Just before we go on to the longer term, I'm just quoting from members of Aruka Network. Aruka works in a number of different families, different countries and communities. And this was a quote from North India from 2 weeks ago. I'll just let you read it. And I guess it's a challenge even to those people who are keen and committed Christians and strongly orientated to their families, that this is still a real challenge. So we need to be very prayerful for each other. And this is a quote from a good friend in Kenya, in Kericho. This concept that everything else is having to take second place because of COVID. And so we don't have any more diseases like dengue and malaria, ... Now we only have one disease. Incredibly untrue, of course, but the way many people are actually perceiving at the moment. This is the main talk that I want to give now, really, is on the longer term impact. So we'll get straight onto this. And this is just a general point to start with. And it's this rather scary one about the starvation, the lack of food, the famine almost, you could say, as a result of COVID. And those statistics are being regularly updated by the UN. That comes from the Security Council. And people are talking about this post-COVID surge in non-COVID associated mortality. So we have a surge from COVID, and then we have a probably even bigger surge from all the impacts later. And let's not forget about the Sustainable Development Goals 2030. They still need to be our guideline and what we're focusing on. So looking at the longer term impacts, I put immunizations first of the specific ones because of the alarming comment made actually directly by the Director General, Dr. Tedros, just a couple of weeks ago, where he said the number of children dying from misvaccination will far outpace the number of deaths from COVID. And that, of course, in the comments underneath explains why. And I expect many of you are already seeing that happening. Incredibly important we keep up the immunizations. If there's anything we can do to just keep those going, that is going to be of value to be saving lives, and it'll help to have the eventual rollout of the COVID vaccine. There's a big increase in the number of what are known as anti-vaxxers, and some of you have probably come across these people. I've been watching demonstrations on some of the streets in the United States. WHO and the Lancet is calling this an infodemic. So we've got a pandemic going on and we've got an infodemic. In other words, too much information, and above all, too much inaccurate information. And this rather scary survey from New York City, which you can read there, that only about half in a large survey of those asked would actually want to give a COVID vaccine to their children. Worrying. This is a worldwide movement, I'm afraid. Well, you can guess what my next slide is going to be about, but before you do that, I just want you to please take notice and enjoy the special shoes which have been designed for my lovely mosquito. So we will indeed be talking about malaria, but we'll be talking also about AIDS and TB and some of the things which the Global Fund has been talking about. And it mentions this concept of dislocation of health systems. As we all know, health systems are the sort of buzzword, incredibly important. Many of them are being fractured and dislocated. Some actually can be strengthened as a result of all the things that need to be done. But the worrying thing is that dislocation is going to hugely increase the number of extra deaths per year. They reckon probably will double the number from those three diseases. Just a few more accurate statistics for those who want them there. And in particular, the guesstimate that malarial deaths will probably double in 2020 and probably in years beyond that as well. Let's just move on to impact on childbirth. I've deliberately not put any statistics up for this. Difficult to find, they continually change, but obviously this is hugely important. Got a good friend who has been really finding this extremely difficult in the Kenyan situation, with difficulties of having antenatal care and so forth and so on. So just to flag up the childbirth impact. But we'll move on now to what is obviously so important, this poverty business. Now, we talk about lives and livelihoods, but it's important to remember that actually it's the economics which have an enormous impact on the lives. Let's not forget that the main social determinant of ill health is poverty. And poverty is increasing. On this slide, you will see on the grey part of the line going down towards the right, that was the sort of projected increase in poverty prior to COVID. And every month it's being increased upwards. So at the time of writing, I haven't got a July or August figure, but basically the World Bank worth looking at this to see how poverty is impacting the world and your particular country. And if we just translate that into the statistics, so the sort of best guesstimate is the 71 million being pushed into extreme poverty, but actually the worst scenario increasing to 100 million. I guess we all love our children, worry about children. In the UK, we're worrying about our children going back to school and sincerely hope that they will be able to go back to school, because that is more important than keeping the bars and the pubs open, which is a big debate in the UK at the moment. But this impact on children and the dropout from schools and the increase in teenage pregnancies, all the things that I've mentioned there, is worrying. 1.5 billion children have had schooling delayed or seriously disrupted, sometimes for up to 6 months. This is another troublesome one, remembering that, of course, if you can't get hold of your contraception, you're going to have a large number of unintended pregnancies. And the estimate is that there are at least 7 million being expected, and quite a number from transactional sex, in order for families to earn sufficient money to actually survive, which is a rather gruesome thought. And then these terrifying numbers of cases of gender-based violence, which we mentioned before. I've said in low and middle income countries, very much true in all countries, unfortunately. A big impact, obviously, on cancer. Here in the UK, the estimate is that we've got a 2.4 million backlog for screening, tests and treatment, just because people have been frightened or not been able to get to hospital to have diagnosis carried out. So obviously cancer is going to increase in its amount, and the good old NCDs. Some of us are very interested in NCDs and some people find them rather tedious. We must remember that they cause 7 out of 10 deaths globally. And this survey from 155 countries shows that about half of all those questioned in those 155 countries have got a serious disruption in their treatment for hypertension, diabetes-related complications, etc., and almost as much for cancer, and a lot also for the cardiovascular. So the impact of COVID long-term on NCDs is going to be very considerable. One or two suggestions in a moment about what we can do about that. Probably you are all aware of this, but I've become more aware of it recently, that actually there's much more antibiotic use at the moment because patients are demanding it. And if you are doing telemedicine, it's a bit easier to prescribe in case it helps than if you're having a face-to-face consultation. And as we look at I think this is one of the last slides on the actual things we're predicting, is the worry about health workers being attacked, partly because there are still many people in the world who don't believe that COVID is a genuine entity, that it's actually has been foisted on them from people from outside, various conspiracy theories. So therefore you attack the very people who are there to help you, which doesn't make sense to us, but I guess there's a sort of sinister sense to it. Just a couple of very quick points to remind ourselves about all the displaced people. So there are nearly 80 million people displaced in the world. This is not including the 1 in 8 people in the world who live in an urban slum. These are people in refugee camps, etc. A particular group we need to pray for and prioritize for. Many of you, I'm sure, are already doing that. And then the indigenous populations, which we tend to forget about, those people who've been living for many, many years in one particular area, and in particular in Amazonia, a huge spread amongst communities that have got really no resistance to measles, respiratory infections, and to COVID. And the destruction, to some extent, of the reservoir of history and culture, because many of the older people will actually be dying as a result. Enough of all the predictions. Let's think of some solutions. Okay, we may not quite know in what direction we're going. We may be a little bit like a sort of modern day Noah, moving in directions with planetary health and all the other conditions we're worrying about, such as global warming and so forth. But let's concentrate and work together on some solutions, crucial of which, no apology, are what communities themselves can do. Obviously, our scientists and our people in senior management and so forth and so on are crucial, our district medical team and so forth, but actually communities know what is going on and are well placed to work with others from their communities to devise collective responses. Brothers and sisters, this is not my idea, though I'm passionate about this. This comes from Professor Cicely Marston and her group called DEPTH, Depth, at the London School of Hygiene and Tropical Medicine. And they go on to talk more about this. Because ideas are community owned, people will follow. We tend to follow things that we own and we have set up more than when we're told what we should do. And that's very effective originally in HIV and in Ebola. But we do need to work with communities to help document and enable them to be as effective as possible in developing these solutions. Some of you will remember the WHO World Health Report 2008 on the resurgence of primary healthcare. I love this central sentence. With an emphasis on local ownership, it makes space for solutions created by communities, owned by them and sustained by them. This is a future for global health, not just COVID, but all others as well. It's so, so crucial. The role of community health workers, always important, is now crucially important. Kenya is currently training 100,000. The African CDC has got plans for many hundreds of thousands to be trained all over Africa. Sierra Leone now has 95 CHWs to one doctor. I like that. Being a doctor, I'm quite pleased that so many things can be done because of this wonderful idea of task shifting. The person least trained to do a job well should do it. In other words, if we have an itchy bum, we don't want to go to A&E, we want to see a community health worker. But if we have a heart attack, we want to go to A&E. So in other words, we go to the right level, which is the whole heart of primary healthcare, of course. This whole idea of an awful lot of stuff we can do ourselves, especially when it comes to NCD. So actually, most people can learn how to take their own blood pressure and measure their own glucose with a little bit of information, possibly a visit from a CHW and so forth. And this helps to demystify and demedicalize information, which should be owned by people and communities, not just by doctors and health workers. And just another area that we can really look at in terms of solutions is trying to do the best we can to make sure that medicines will remain available. So it's a matter really of looking at the supply chain and seeing where the blocks are, and then doing our best to unblock. And it's going to be medicines, it's going to be contraceptives and condoms. If we don't do this effectively, the number of STIs and HIV are estimated to rise very considerably. And this worry about if people have to always wonder where their medicines are, keep on going out to look for them, it will often be women, and this is going to increase the danger of rape and other problems, especially for women who so often are given these jobs, unfortunately. I've never particularly enjoyed diabetes because I find it a rather complicated disease. Some of you will be absolutely horrified by that, and some of you will probably identify, but let's just remember that 1 person in 11 in the world has got diabetes. That doesn't mean to say they all know they've got it. And COVID and post-COVID is hugely increasing the worry because of the various things I've listed there: the food insecurity, the difficulty of getting hold of insulin, the storage, supply chains, etc. And an important solution which most of us are using, some of us are loving, others are not so fond of, are all the different ways we can now think creatively in terms of using information technology. Whether I'm deep in Malawi or deep in the Amazon, all I need is a mobile phone and a connection that allows me to talk to a clinician. A bit simplistic, but a pretty amazing comment that somebody said to me the other day on a Zoom call. I do want to just flag up this very important commission, which is going to be giving us the real ongoing answers we will need about how to deal with population health in post-COVID-19. In other words, what I'm trying to talk about now and getting the best guesses and the best estimates from different specialist groups, this is going to be put into and improved and taken forwards by this commission. And you can read about it in the Lancet, details are there. That is going to be the key thing to be watching for in the next few weeks and months. Let's talk with joy about the additional opportunities as people who love Jesus Christ and who work for Christian organizations or as church leaders, etc., the role that we have got. And many of you will know that it took the World Health Organization an awfully long time to discover that actually faith-based organizations and churches and Christian groups and mission hospitals in particular were providing a huge amount of healthcare, but they did eventually discover that, and that's the famous paper they wrote back in 2007. This is one estimate of the world's population having a religious faith. It's the lower estimate. 84% is now being mentioned by some, and BBC were mentioning the other day on a program that it's more like 86% and probably increasing, not decreasing. In other words, we may think the secular world is sort of gradually taking over. That is not in line with the statistics. Back in 2015, and I have to say that this arose in part from a discussion at the Christian Medical Fellowship a few months before, there was a whole edition of the Lancet on faith and health. And this was a summary. I'll just let you read it because it's very encouraging. So it's in the academic arena to talk about faith-based organizations and the value they bring. And basically that's the reason. Virtually every community in the world has got a church or a mosque or a temple. Many have got one of each. An increasing number have got churches. They need to be involved in the whole process in post-COVID and during COVID. This was a very nice comment which I came across in a well-known organization, a secular organization actually, and a very interesting comment from a Muslim group. People are more likely to trust a faith leader than an NGO they may not be familiar with. The organization is more welcome in communities where it has religious partnerships. I attended a webinar a few weeks back, which was led by London School, Save the Children, and so forth and so on. And 75% of the time was talking about the value of faith leaders in Africa in terms of what can most usefully be done in COVID and post-COVID. So let's be encouraged and excited by that. There is a but here, because I guess we all know that some church leaders and some faith leaders do not always promote what is true and what is scientifically helpful, and especially those groups that speak from what I call the extreme end of their belief spectrum. In other words, guys, all you need is faith and prayer. You don't need to take your medication for HIV and so forth. Faith and prayer will do it. Faith and prayer is wonderful, and it's God's gift to us, but so is nature and so is science. So this wonderful combination of believing in Jesus Christ and faith and prayer and so forth, and also believing in the science and the truth, is a phenomenal combination. If we can just encourage our Christian leaders and our faith leaders to bring those together. And there's a lot we can do actually as healthcare workers, as dentists and doctors and others to help that happen. Coming to the end now, I just want to talk about, or just show you the slide, collaboration. We need to work together with all people who are doing their best during COVID and post-COVID. We may not agree with them about anything else, but if we can agree on this, we are going to be helping the world. And I believe that's in line with God's purpose and plan for our world. And my last question before we just sign off is, yes, COVID is very important, but I just want to flag this one up. So my plea is, let us look at all that we can do for global health post-COVID, but also look at what needs to be done for increase in climate change, because those two things go together and is a great opportunity for us to do a double act. Thank you for listening, folks. This is a book that I and 14 colleagues have recently written, published by Oxford University Press. Those are the details. You can buy the book, but you can also download this free of charge anywhere in the world. And if you go into the Oxford University Press link there, that will tell you how to do it. And I will just leave you with this final slide about Aruka Network for Global Community Health. You are more than welcome to join us and bring your own wisdom and blessing to what we're doing. And just to finish, to say God bless you and thank you very much for listening.
Thank you very much, Dr. Ted Lankester. We're coming into a time of questions now. So please type your questions into the Q&A box that you'll see along the bottom of your screen. And you can also upvote other people's questions there. And then as the questions are asked, I'll put them to Ted Lankester. And we'll run up to about 3 o'clock with those. Don't put questions into the chat box, but into the Q&A box. We've been listening to Dr. Ted Lankester talking on the longer term impacts of global health of COVID-19. And if you've joined us during the presentation, then translation is available. You can click on the interpretations box at the bottom, and you can then listen to the answers to the questions translated into French, Spanish, Arabic, or Chinese. The Arabic translation, you need to click the German box because there is no Arabic one. So please do send your questions in for Dr. Lankester. And we've got a first question here, Ted. Are there any positive long-term impacts of COVID on global health? You've painted a dramatic, evidence-based, comprehensive picture of the effects right across a whole range of different health indicators. But do you see any positive long-term impacts of COVID on global health? Or is it all just disaster?
Yes, I tried to, I guess I tried to sort of say at the beginning that the role of the church, and perhaps at the end that slide on collaboration and working together. I also mentioned, and I want to sort of re-mention, that there is a tendency to emphasize the gloom and doom and how bad things are. I think some of us who sort of look back, you know, in the past at our own country, and we think how difficult things are now, we realize actually they're probably a whole lot better in many countries, certainly in the UK, than they were. As a result of this. And I think it's also going to help us all, how can I put it exactly, spiritually, to realize that our world is not just, it's going to, I think, make us a little bit less self-centered and a little bit more aware of other people and their needs. Many other things I could say, and you will all have your own ideas, and my challenge would be, whatever think of the positives that you think might work where you are and work on those, quite apart from the solutions I've been suggesting.
Thank you very much. Please put your questions into the Q&A box, not the chat box. Question now, you raised the issue of the relationship between faith and science, Ted, and you talked about the importance of holding both equally together. Can you speak at all about how church leaders can best do that in keeping a right balance between what God reveals in his word, if you like, and what he's revealing through the world in science and technology, and how we can promote both as God's gifts?
Yes, I'll try to answer that question, which interestingly, I did a previous webinar, and something I said caused a certain amount of alarm. So I hope none of this will alarm you, because I do think this is very much a sort of combo thing. It is the science and the truth, and it is the faith and the prayer. And one thing that strikes me as being just to some extent a no-brainer, as we say sometimes in England, something that is so obvious, is that if only Christian leaders and church leaders not only preach the gospel of salvation, but also explain how they can avoid COVID as best they can by social distancing and all the other, contributing to the spiritual and the physical well-being of Jesus that we're told about in Matthew's gospel, the people who are hungry, poor, naked, ... This is an amazing opportunity. I think whenever we have an opportunity, we need to kindly and gently talk to the church leaders we know and encourage them to do that, and pick up if from time to time they are saying things which we feel are not actually in line with the science. But we need to do this in a very gentle way, and we need to do it in terms of relationship and the desire to want to work together. There's loads more I could say about this, but that would be one thing. The other thing is let's work in the theological colleges and the Bible colleges and help the emerging church leaders to remember that they do and must preach the gospel and make disciples, but they also must care for the physical and psychological and emotional needs of their congregations.
Thank you. Now Healthcare Mission, of course, brings together both the word and works of Jesus. What do you think will be the impact on healthcare, on Christian healthcare mission in the post-COVID era?
Well, many people are discussing that in great detail. We've got a group in the United Kingdom, some of you know, called Global Connections. They're doing a series on that in the coming weeks, and webinars and so forth. One or two quick thoughts on that. I think we're going to see something of a further swing away, probably, from global north, Western-based missions going and doing their bit in other countries. And I think we're going to see an increasing role of church leaders, Christian social entrepreneurs from low and middle income countries, sometimes from the most vulnerable communities, who will actually be themselves, how can I put it, the missionaries of the future to their own communities and to their own countries. So I think we're going to see a sort of slight further turning on the back of the idea that it was the West to the rest, to the fact that it's now all those people who love Jesus, working within their own country, going from one country to another. I love the thought that, you know, people who are excited in Kenya about all that God is doing can go and tell people in Colombia or another part of the world. So a huge emphasis on the role of national leaders, church leaders, and also I think of the international aid agencies, the Christian groups like MEDAIR and Tear Fund, especially through the work that they are doing through their national leadership and national partners.
Ted, you mentioned about the impact on immunizations and some terrifying statistics about how both the rise of the anti-vaxxers and also the fall in immunizations for the diseases that are killing most, especially young people. What's your assessment of how future vaccine production for COVID could negatively impact on other vaccine production? Do you think there's a risk of it taking over when a vaccine becomes available? And if so, how might that be mitigated?
I think that's an extremely profound and really, really important question. I keep slightly in touch with this because my son-in-law is actually involved with the vaccine unit that is being worked on in Oxford. So we do have discussions about these. I think my own view here is to not go down the doom and gloom thing that, you know, COVID is going to replacing everything else. My hope and prayer is that WHO and others are going to be doing two things. One is encouraging the use of COVID vaccine and incidentally flu vaccine, hugely important as well, alongside improving and increasing the amount of immunizations that are being carried out on children. I think it's vital these two things go together rather than one replacing the other. And I think, again, I'm sure this will be led in a sense from WHO and UNICEF and so forth, but something we can really help in our own communities, our own countries, with our own district medical teams to make sure that that is actually happening, that both are going on at the same time.
Question here, one of our listeners saying they loved your emphasis on community-based intervention, really fascinating. But make the point that in urban settings, there's often not the same community cohesiveness. How challenging is the diversity of urban communities, and how do we go about addressing it properly when there don't seem to be you know, natural recognized leaders, if you like?
Well, on the positive side, some of you will know about an amazing Christian health program in Delhi called ASHA, A-S-H-A, and the fact that they are now working in 65 different slum communities, and basically each community is led by a group of people representing all the different ethnic groups in that community. So it's become an astonishing effort in impact. I do realize that that's much more difficult in other areas, and the amount of writing and the ideas of what you can do effectively at community level in slum communities is still pretty meager. Back in 2000, three of us wrote a book for Macmillan, looking at some of the options there. But I think in any situation, we need to recognize, we need to identify champions and thought leaders and entrepreneurs whom we come across and realize will be potential leaders, and nurture them and coach them and encourage them to bring people together. And in Aruka Network, we're actually doing that in 2 or 3 small towns as well as rural areas. And we're finding it's working very well. Even in Bihar, a group of 30 to 40 different Christian organizations are coming together and doing some work collaboratively. So let's be really positive about the options. It's more difficult, but it's not impossible. And I think those are some of the ideas that we could follow.
Thanks very much, Ted. We're listening to Ted Lankester on the global effects long-term of COVID. The next question, again, someone thanks you for the talk, beautifully presented. So much hope in what you said. All we hear is despair. So important to hear the importance of the strength of communities and what influence they can have, and especially the importance of collaboration. What are your thoughts about interfaith dialogue and interfaith cooperation in this context? And it perhaps builds on what you've already been saying about Asher.
Yes, two thoughts on this. First is, of course, as Christians, we have a unique message of redemption in Jesus Christ, and that's part of our mantra, if you like. That's part of our value system and our beliefs. But we do almost remember that God loves the world. The light that lights every person was coming into the world, and I believe passionately that we are meant to work with people of all faiths and none together collaboratively when it comes to a shared issue, such as COVID, such as any other disaster. And it was very interesting, for example, that this worked very effectively in Sierra Leone when Christians and Muslims got together. And some of you will be surprised, actually, that there was a joint paper written by one Muslim organization, Tear Fund, and 2 others who I can't remember, explaining how that actually works in practice. So on the one hand, we have a unique spiritual message, but on the other hand, we have a further mandate to work collaboratively in friendship and kindness and mutual understanding with other people who are fighting the same disasters and the same challenges as we are.
Thank you. There's a couple of questions here about the role of faith communities in living in countries where the regimes are hostile to faith communities, and where Christian and perhaps even other faith communities can be suppressed or not heard or marginalized by leaders. How can Christian communities make the best impact in a post-COVID world in those kind of situations that we can imagine, particularly in the Middle East and North Africa, perhaps?
I realize that is very difficult, but I wonder if some of the teaching that Jesus gave us about respecting authority is important. And it strikes me that if we are doing things which are clearly of value to the health and well-being of communities, and we dare to, where appropriate, communicate what is being done with appropriate friendly voices in government or in the district medical team or whoever, I think we can just gradually change the perception in some countries. I have seen this happen in one state in India to a most extraordinary degree, where at one stage the quite extreme Hindu-led government a few years back was extremely suspicious of Christians. But now that a whole group of Christians, about 40 groups, have been getting together as part of a network, the government is now actually asking them to train their government health workers and to do care for patients with COVID out in remote communities because they can't do it themselves. In other words, because they work together for the well-being of the community and talked carefully and kindly to the government, it is changing their perception. And 3 weeks ago, they were even commended in 2 state newspapers, one in Hindi and one in English. So that all seemed impossible 10 years ago. So I think there are some ways forward here, hard as they are, and sometimes, we will not always be successful.
It said that crisis means threat plus opportunity, and we're hearing a lot about the threats of COVID from a whole range of outlets, but particularly, you've touched on this already, but what are some of the opportunities for the church in resource poor situations to really make an impact in the post-COVID world? Perhaps opportunities that are greater now than they were before this struck.
Well, I'm sure many people who are listening will have their own experience of that. But just from 1 or 2 comments from friends in Aruka Network who are working as Christians in these communities, some obvious things, for example, in Rwanda, visiting people who have not got smartphones and don't know what's going on and making sure that they got enough food. Menstrual hygiene packs for girls, making sure that soap is available and being distributed. There's one beautiful story about a group of Christian women in Kericho in Kenya who realized that the police, although some of them were being a little bit heavy-handed, were also exhausted and made meals and took to the police in the streets out of kindness. And I think one of the things that we can really do as Christians is to show kindness, gentleness, welcome to people we would never normally talk to. And we can surprise people by the love we show, which in turn breaks down barriers. And we can say to people, we realize this is really difficult. What can we do to help you? We can obviously pray for you, but is there anything else we can do? Can we collect some medicines for you? Anything we can do to help your children while you just have a bit of rest? So a whole range of different things. And we will all come up with different ideas. But I would have said love and kindness and creative thinking about what people really need, and then working to make sure that we can do our best for them.
Thank you. Well, powerful stuff. You've touched quite a lot on vaccines. We know that vaccines aren't yet available, but many are being developed. We know there's a lot of skepticism about them as well, and the rise of the anti-vax lobby. The question here asking, how will we know which vaccines to trust when there are vested interests, perhaps both from politicians and drug companies as well? Any pointers about where we should listen for the wise voices on vaccines and treatments as well when they become available?
Well, the first thing to say is I'm not an expert on immunizations, but 1 or 2 quick thoughts. So it's interesting that Russia has announced that in October they would be rolling out a vaccine which they have think is safe and so forth and so on. I don't know if that's going to happen, but it was actually on the BBC News. Many of us are wondering, would like to have more details about that. The actual Oxford vaccine, which in the UK is being promoted, to more probably than others. So there's another very good candidate as well. That's undergoing phase 3 trials, likely to have answers in November as to whether from challenge studies this will actually prevent people from getting COVID. We know that antibodies are being produced and it looks very promising, but the key thing is the vaccine safe? And will it prevent people from getting the illness? And how long will it work? Will there need to be a second dose? Will there need to be one every year? So all those different issues need to be worked out, but with the minimum of delay once the answers are there. And I know that the editor of The Lancet about 3 weeks ago was asked directly, when does he think that it's likely that there will be a effective vaccine available? And 3 weeks ago he said, my best guess is by the end of the year. So I think we need to be avoiding the people who are terribly gloomy saying, oh, this is far too difficult, but also being slightly cautious about people who are overemphasizing the safety when we haven't yet got that confirmed.
Lovely, thank you very much. Well, I'm afraid we're just about out of time now. I've got one more question for you, Ted, because I've had the privilege of listening to you speak on many occasions over the last couple of decades, and your comprehensive grasp of the big picture and your mastery of all the information is always so helpful and enlightening. So my question to you is, for doctors and dentists who are listening, wanting really to be at the cutting edge of what's happening with this, what are the best sources? You've quoted quite a few, but for you yourself, how do you best keep up with what's happening as a Christian doctor wanting to know the big picture on these issues?
Okay, just a few thoughts. Number one, listening. Listening to what communities are saying and listening to the solutions that are being tried by communities and looking carefully to see if they are actually working. Obviously, the World Health Organization, Johns Hopkins University has got an extremely up-to-date, ongoing set of information about what's going on. In the UK, Save the Children is probably the lead organization that is really looking at some of the effective ways in which, if you like, the sort of NGO community and others can work. UNICEF, the World Bank, information from a website called Worldometer. You just Google Worldometer and it gives you all the accurate statistics for each country day by day, a quite remarkable collection of information. And I would have said also listening to news sources of information in your own country once you have got some degree of confirmation that they are speaking scientifically and with wisdom. So we need the big picture people from the top. We need the wise regional and district and national people, and then we need to listen to community voices.
Thank you. Well, it's been a great privilege for all of us listening to you today and gaining from your insights. Now, you'll be pleased to know a lot of people have been asking about the presentation, and we will make Ted Lankester's presentation available in PDF format. We'll write to you after the webinar with information about all ICMDA webinars, and it will go up on our YouTube channel in the next 24 hours, and it can be accessed also via our website on the webinars tab in the drop-down menu. The next webinar in our series is this same time next Thursday, the 13th of August, and we've got Professor Raymond Beatty, who's going to be speaking about a dental perspective on COVID. So I know we've got lots of dentists listening, who've been longing for this. We couldn't have anyone better qualified to be doing that talk. So tune in with us next week for that. Please continue to spread the news about ICMDA webinars. Make use of all of those that are already up on the website and YouTube channel. And we hope to see you again. So just in closing again, thank you so much, Ted Lankester, for talking to us about the longer term impacts of global health on COVID-19. Thank you for our translators working behind the scenes, making that more accessible. We look forward to seeing you again. God bless you and see you soon.